Hi, good evening.
Hello.
Hi,
Hello.
my name is Yanaris. I'm a nurse practitioner. Okay.
Hey,
What is your name?
Patricio, or you can call me Patrick.
Okay, Patrick. Good to meet you. Nice to meet you. And mom, what about you?
My name is Anais.
Okay, nice to meet you. Okay.
I'm here.
Um, can you tell me a little bit about why you're here?
So we're here because he's been having trouble at school. Like he's forgetting everything. He's forgetting to turn in assignments. He's forgetting to do homework. It's been it's been going on for like 6 years now, but now it's worse in the 6 months, and I think we've reached rock bottom.
Okay. And you said it started 6 years, right? You said it's been ongoing for 6 years?
Yeah.
Okay. And is there anything in particular that it makes the symptoms worse? Is there anything that makes it worse?
When he doesn't sleep like his full 8 hours,
Mm-hmm.
or if he has to sit for a long time, or if there's any distractions, I notice that he's worse. We've noticed mainly now because he's taking algebra and is very noticeable in algebra. Is not his best subject, and I think maybe that's part of the issue.
Okay. And is there anything that makes it a little better?
Of course, when it's not about algebra, if it's like a subject or a topic that he enjoys, then it's not as bad.
Okay. All right. And for the difficulties at school, have you gotten any reports or complaints from the teacher?
Yeah, they pretty much say the same thing. He doesn't stop moving. He fidgets constantly. He has trouble following directions. He's often like disrupting the class. And he has like issues like remembering tasks. Like if he's told to do something, he has to be told multiple times because he forgets.
Okay. And he like moving constantly and stuff like that.
Yeah,
Yeah.
like basically won't stop moving, walks around like in class and whatnot. And the teachers, I think, are we've reached a point where it's not like affecting his grades, and I think this is it.
Okay. All right. All right, Patrick, I'm gonna ask you some questions. Is that okay?
Yes.
Alrighty. All right. So have you ever or do you ever have thoughts in which you kind of wish that your life would stop or end?
Oh, no,
No? Okay. What about thoughts of wanting to hurt other people?
no.
Okay. And how's your sleep?
Um, Sometimes I don't get my full 8 hours, but sometimes when we like, but when I do, like, sometimes it's like,
Okay.
so sometimes like
You
it's
you have
difficult to fall asleep, huh?
yeah.
I hear you in your room
Okay.
walking around when you should be going to sleep. Yeah.
Okay. And how's your appetite? Do you have like any decreased appetite, or you wouldn't say you have any issues with your appetite?
No, I wouldn't say I have any issues.
No? Okay. Mom, any allergies to drugs, food, latex, or anything environmental or herbal?
No, no allergies.
Okay. Patrick, would you say you're a healthy kid?
Yeah, I'd say so.
Yeah. Okay. Mom, any um past psychiatric history, like anything including inpatient hospitalizations or outpatient treatment, even for like substance use or anything like that?
No, he's never really been in the hospital. The only time he was in the hospital was when he was like 2 years old. That, of course, he was running around like crazy,
Okay.
and he smacked a marble table, and he had like a cut in his eyebrow. It was this eyebrow, so the right one? Yeah, the right one. He still has a scar there. It's really small though. Yeah, and had to put sutures and whatnot. But I think that's the only time he was in a hospital.
Okay. And no history of suicide attempts or self-harming?
No.
Okay. Any major or chronic illnesses?
Not currently. He used to have asthma. He was diagnosed, I think, when he was like around 4 years old,
Okay.
but it's been resolved. He's not on any medications for it, and he hasn't had any asthma exacerbations in several years now.
Okay. All right. And doesn't take any medications for it anymore.
No, no.
No. Okay. Any past surgical history?
No, other than the little
No.
scar that he has, that's it.
Right. Okay. And does he take any current psychiatric or prescription medications?
No,
Okay. And any over-the-counter or nutritional, anything herbal or complementary, any
no,
medications like that? No? Okay.
no.
All right, Patrick. Question goes back to you. Um, I know it's kind of a weird question, right? Because you're a young kid, but do you drink alcohol?
No.
Okay. Do
It
you
prob-
do, sorry?
it probably tastes gross either way.
Okay. Do you smoke cigarettes or marijuana?
No.
Okay. No vaping,
I mean, I've seen some kids try that before,
but
but
you've
that's
never done it. No. Okay. And what about caffeine?
no, not really.
No. Okay. Mom, what about family psychiatric history?
Well, I have anxiety.
Okay.
My husband, his father, has ADHD. Um, my mom has anxiety and probably some kind of mood disorder. She refuses to go to a doctor, so God only knows. Um, my sister has anxiety, and my dad doesn't really have any history,
Okay.
but his uncle on his dad's side does have depression.
Okay. All right. And then maternal grandfather, your dad doesn't have anything. Okay.
No, no,
All right. Alrighty. And then okay, so Patrick, you told me no cigarettes, no tobacco either, right? No.
No.
And are you married?
How? What
Okay.
do you get married?
No girlfriends, you're single.
Nope.
Okay. And any jobs? You have like a part-time job or a full-time job or you just go to school?
Just go to school.
Okay.
What would I even do? Like flip burger?
Hey, who knows? Alrighty. And you like girls?
Yeah.
Okay. And kind of another weird and sensitive subject, but have you ever had sex?
No.
Okay. All right. Have you ever been abused physically or touched inappropriately, anything like that?
No.
No. Okay. All right. Mom, how, tell me like developmentally wise, like was he born without complications? Was he a preemie?
no. He wasn't a preemie. He was born full term. He was born via C-section because basically he wouldn't come down.
Mm-hmm.
Um, he was not in the NICU or anything like that. The only thing was during my pregnancy, I did have gestational diabetes, but like I just did diet and exercise. I didn't have to do any drugs or injections or anything like that.
Okay.
Um,
And
mhm,
and he reached all milestones without any issues.
yes.
There's been no trauma. He gets along well with his like peers and family.
Yeah.
Okay. And where does what's the living situation like?
We live in a house. It's me, his dad, my husband, and I also have another son who's 10.
Okay. Alrighty. So, I went ahead and reviewed the Vanderbilt form that was filled out by the parent and teacher form. All right.
Hmm.
So basically, they were kind of identical, the teacher and the parent form. Um, it pretty much just shows, it indicates that there is like a combination of the ADHD. So there's an inattentive and a hyperactivity component combined. So that's basically what the Vanderbilt A form, like what it shows, the results on there. Okay. Any exposures to smoke or any like lead exposures, anything like that?
No, nobody in the house smokes, and the house is pretty new.
Okay. And vaccinations, are they up to date?
Yes.
Okay. Um, Patrick, so questions go back to you. Have you lost any weight? Do you have any mom that you know of any fever or any chills or just feeling bad?
No.
Okay. Any headaches, changes in your vision, like blurry vision, any hearing loss or issues with your nose or sinus issues, anything like that?
No, not really.
Okay. Any sore throat, nasal congestion or difficulty swallowing?
Nope.
Okay. Any tenderness in your neck or neck pain or like little like swollen lymph nodes like right here that you feel anything like that?
No.
Okay. What about shortness of breath, coughing, wheezing, or coughing up blood?
No.
Any chest pain, palpitations, or swelling?
Nope.
Okay. Any nausea, tenderness, or belly pain?
No.
Any episodes of dizziness, fainting, or seizures?
No.
Okay. What about joint pain, joint pain or tenderness, or swelling in any of your joints?
Nope.
Okay. And skin-wise, do you have any skin rashes or any bruising on your skin?
No.
Okay. And then you told me you have trouble you have trouble falling asleep, right? You sometimes don't get full 8 hours.
Yeah.
Yeah.
Okay. All right. And then no history of any infections transmitted sexually because you told me you don't have sex, so that's good. All right. Vital signs, mom, they all look great. So his blood pressure was 110 over 98. We took that sitting down. His temperature was 98.2, heart rate 85. His respiratory rate was normal, it was 18. Um, we got height and weight. It was 5 feet and 110 pounds. And then he falls within the 87th percentile for BMI, okay?
Okay.
So everything looks great there. All right. So let's talk a little bit about like plan wise, like what we plan to do. So he definitely has ADHD with a combined presentation, okay? And I think that he would benefit from medications. Typically, stimulants are especially helpful. Okay. There's a medication called Concerta. Initial dose for that is 18 milligrams, and it's just taken once a day. It can be titrated up, but initially we start with a low dose of 18 milligrams, and then we'll increase as as we're assessing how it's working on him and any side effects and stuff like that. Okay. Some things to keep in mind while taking the medication is to avoid caffeine while taking it. It is a stimulant. And so if take caffeine with it, it'll make it worse, right? It can give palpitations. Concerta usually, so there's like a website or an app that you can download on your phone that's called GoodRx, and it usually costs about like $37 with one of those coupons. Along with the medications, it's also beneficial to do some therapy. Like for example, with ADHD, there's cognitive behavioral therapy. It pretty much just, teaches him like coping skills and stuff like that. There's also classroom interventions that we can do, like for example, getting an IEP done for him at school that will do we'll give him certain accommodations in school, like keeping him away from the front of the class and just minimizing distractions. That tends to help. Okay.
Okay.
So just some family education at home that might help. So, just to give like precise directions, and brief routines, and then, guidelines as to what you expect behavior to be like. Setting modest but goals that are, that he can achieve, nothing unrealistic. And then just watching out for any symptoms of overstimulation and try to stay away from those kind of triggers in daily life. um the excess energy that he has can definitely it helps to be involved in sports and exercise to kind of like release that energy. And just give credit basically and praise whenever he finishes a task. I know with ADHD, sometimes they have a hard time finishing a task, so giving them praise when they finish one, is helpful. So just some little educational points that might help. So I'm gonna go ahead and give referrals, for a psychologist to start the therapy, the CBT, okay? And then
Ideal.
I'm also I didn't see like any labs or anything like that. So I'm gonna go ahead and also like do like a referral to the pediatrician so we can get some labs done. Typically we want to try um to check for thyroid function just to rule out any medical causes like hyperthyroidism, for example. And then I'll do a follow-up appointment in 4 weeks and see how he's doing with the medications, and see if, we need to go up or whatnot. And then I'll send the prescription over to your preferred pharmacy.
Okay.
Do you have any questions?
No.
Patrick, any questions?
Oh, no.
No? Okay. All right. So if you guys need anything, you can email, and we'll stay in contact, okay?
Okay.
Okay.
Thank
Thank
you,
you.
Miss.
Thank you. Nice to meet you. Bye-bye.
Thank you.
Have a good night.
Bye, you too.